the final domain that we might talk about are sort of dealing with the sort of cognitive or more thought-based aspects of sort of chronic pain. We've touched on these a little bit when we talked about therapies like cognitive behavioral therapy, acceptance and commitment therapy, or mindfulness-based stress reduction therapies, things like that. But there's some important things to say about this. So one of the most important things that we probably might say is that just because you're having a negative experience does not mean that you have to be suffering. So part of what we seek to do when we're applying these therapies like ACT, which is how you say acceptance and commitment therapy, an acronym, or CBT, is trying to reduce some of the fears, the negative beliefs, sort of restructure the way that you think about your own life experience, help you process some grief and find new meaning in how you want to engage with the world, practice disconnecting from the things that are uncomfortable for you and reconnecting with the things that are meaningful and important for you, and start to forge your own meaningful action moving forward in the world. So when we focus on these things from a psychotherapeutic perspective, that can also sort of drive a reduction in people's pain experiences. It turns out that looking at some of these underlying factors that can be causing some of those other symptoms we talked about before, whether it's the pain catastrophizing symptoms, the fear avoidance symptoms, even some other things like just not being able to tolerate grief very well, or having like almost pain flashbacks, if I can coin a term, depending on what sort of emotional experiences you have. All of these things working together with these sort of underlying approaches of a cognitive behavioral therapy can sort of reduce that overall suffering that people experience, restructure the way that you experience your symptoms, allow you to have a more open and accepting perspective on these things, and allow you to live a meaningful life once more, engaging in the things that you really care about at the end of the day. So there's a very multifactorial, multifaceted approach to modern chronic pain that's really developed quite a bit in the last 20, 30 years, thanks to the contribution of a bunch of the people I named in these videos here.